A 40 years old patient with mass on her forehead. On examination, she had fluctuant pulsatile mass on the forehead. Examination of her neck reveals the mass inferior to the hyoid bone with positive Berry's sign. So what is the most likely diagnosis here? The mass in inferior to the thyroid in positive Berry's, it is positive Berry's test. It is diagnostic that it is the swelling or the tumor, it is arising from the thyroid gland, because in thyroid gland there is the positive Berry's test positive. And also there is here, you can see the mass on the forehead. That means the tumor or cancer from the thyroid gland goes to the forehead via the blood circulation. So what may be the options or answering options? Here the options are the follicular thyroid cancer, medullary thyroid cancer, papillary thyroid cancer, anaplastic thyroid cancer, and parathyroid gland cancer. So first of all is the follicular cancer or the follicular cancer. It is less common than the papillary. The follicular cancer, it compromise about the 20%. On the other hand, the papillary, it is about 60%. So the follicular carcinoma, it is relatively less common than that of the papillary carcinoma. And in case of follicular carcinoma, lymph node metastasis is uncommon, and in the follicular carcinoma usually there is the blood-borne metastasis or hematogenously there metastasis. And also there is the higher mortality rate. So when the cancer incidence is more, their mortality less. When there is the incidence is less, usually mortality very high. The follicular carcinoma, it is 20% case, so the mortality very high. On the other hand, the papillary carcinoma, it is about 60%, and in this condition mortality relatively less. The follicular lesion cannot be accurately diagnosed on the FNAC. So FNAC is not enough for diagnosis of the follicular carcinoma. So the diagnosis of the follicular carcinoma usually requires the biopsy. And the Berry's sign, what is Berry's sign? Absence of carotid pulse due to malignant thyromegaly. So it is due to the thyromegaly. That means in case of thyroid gland enlargement, there is Berry's sign positive. Papillary thyroid cancer will tend to spread by lymphatics, and disease that is nearly always confined to the neck in case of the papillary carcinoma. So in case of the papillary carcinoma, the disease usually confined to the neck. But follicular carcinoma metastasize hematogenously, and it can goes anywhere in the body, but most commonly is skull involvement. So when there is mass in the forehead, that means the blood-borne metastasis of the thyroid cancer. So what is the cause? The cause is the follicular thyroid cancer. And the medullary thyroid cancer, it is metastasized by the lymphatics. And the medullary, in case of medullary thyroid cancer, there is family history positive. In medullary thyroid cancer, there is the family history positive. In case of papillary thyroid cancer, it is spread by the lymphatics. So it is spread by the lymphatics. Anaplastic thyroid cancer, in case of anaplastic thyroid cancer, this is rapidly destructive and rapidly spreading, and most dangerous thyroid cancer is anaplastic cancer. On the other hand, the parathyroid gland cancer, which is usually less common, but in this condition there the calcium level will be mentioned in the question. So our final answer is the follicular thyroid cancer, because the follicular thyroid cancer, it is spread by the blood.